you just tell me a bit about that day? Because lots of folk were saying, was this something that the hospital asked you to do in front of Mr. Javid because they faced losing 1,000 staff as a result of this policy? Or was it something that just happened naturally off the cuff?
Well, thanks, Anne, for having me on. Appreciate the opportunity to come and talk. So I was just on duty that day on that intensive care unit. It's the one unit where the patients who are COVID positive come to. And no, there was nothing planned beforehand. My boss knew I was there, and we were just told, be normal, no pressure, you haven't got to do something or say something. And then Sajid Javid came into the unit, and first of all, we had a bit of a chat about the patients who were on the unit, the experience during the pandemic when the numbers were much higher. And then he walked over to the nurses, and then you saw the video as that was. I was not prepped or primed or asked to say anything beforehand. And, yeah.
And what happened afterwards? Did you have any idea of the storm that your comments would create? And were the hospital mad, or were they secretly thanking you for bringing loads of attention to this issue?
I haven't had really any direct response from the hospital itself. They've been very neutral. I think it's been very fair on their part. There hasn't been any sort of hassle. For my colleagues, it's been difficult for some of them because every time my name's put out as King's College Hospital, in some ways it represents them, and they didn't ask me to represent them, and I didn't really want to be a representative necessarily, but there's a voice of an awful lot of people. Many thousands of people have contacted me since that episode and said that, I was a voice for people who haven't been heard before.
Because, of course, we're told constantly, Dr. James, that the NHS are in crisis, we're facing a staffing crisis, and as it stands today, we're just going to sack 70,000 of you. That's the number, right? That's the number of NHS workers unvaccinated as it stands.
Yeah, it's about 70,000. There's some reports it'll be about 50 who will actually leave their jobs. Some think it might be higher. I know some people who are moving jobs, going to Wales or Scotland, and have just sort of hopped off and are going now and not discussing the issue of whether it's to do with vaccination or not. That's an awful lot of people. There's 100,000 members of staff already missing from the NHS, so you're just increasing that problem.
And what seems particularly peculiar to me is that the government is talking about bringing an end to all of these emergency measures. Do you have any sense that they might pull back from this one at the last minute, that this is being used as almost the ultimate nudge to try and essentially coerce NHS workers into being vaccinated?
Well, we certainly are being coerced. A lot of people are writing and saying that they didn't want to have the vaccine, but they've not got another way of feeding their family, and they feel they've got to take the jab. Yeah. I understand the position has been scary for the government at different stages, but they've also got, if they're going to say follow the science, they've got to follow the science. And right now, it's not scientific to force NHS workers, not just NHS workers, but it's all CQC regulated healthcare institutions, so private sector as well. It's not just frontline staff, it's someone who's in an office because a doctor walks into an office and meets a receptionist or a secretary. It's them as well. It doesn't make sense to sack all these people.
And Steve, what do you say to people who say, why don't you just get vaccinated then if you want to keep your job?
Because it's really about principles. I mean, doctors, we are thinking about what we're doing and why we're doing it when it comes to a medical intervention with patients. There's three factors that I see to it. You talk about the risks, you talk about the benefits, and then you say, well, how do you see those things? How do you as the patient weigh those things up? And for me, I don't see how I can keep doing that for a patient when I say, well, I've bypassed that process myself.
Do you know what I find so extraordinary? We were told at the start of this pandemic to celebrate and trust our brilliant NHS workers, but we don't trust them to have bodily autonomy. I find it genuinely quite extraordinary because I know that I trust you as a doctor to make the decisions about whether you have antibodies, about whether you need this vaccine as a healthy young man. And that's why I'm so opposed to this policy.
Yeah, it's a little bit strange to have been trusted to do the graft and then be quite insultingly called unprofessional or not following a duty of care in the way that people are managing the situation. Right now, there's a lot of very, very interesting data coming out showing that the infection rates are higher per person unvaccinated, per person vaccinated compared with person unvaccinated. And that's just that the whole statistics have been turned on their head.
And just to clarify, you do think there are groups in society, the vulnerable, those with comorbidities, those who are morbidly obese, those who are particularly old, you do think it makes sense for them to be vaccinated?
Very much. But what we've gone from is a message about vaccines are good for reducing the death and the severe illness that we've seen from COVID-19 to vaccines are just good. And if vaccines are just good, then, well, shouldn't everybody have them? That doesn't make sense. We need to start getting a bit nuanced, start looking at, OK, in this group, this is the problem, in this group, it's that problem. Essentially, you've got those who are at risk of significant illness, and you've got a healthy working age population who's not really at risk of COVID. It's more like seasonal flu. And then you've got children who, well, I really don't think they should be having vaccines.